We are live. Hi, everyone. Thank you all for joining us today for our Workshop Wednesday series. I'm just going to give it some time to get going and for people to join on. As you can see from the title, we are finishing our third series. We're finishing our drug addiction and prevention series today. This is going to be our third workshop in that series, but we hope to continue the conversations. Hopefully this won't be the end of all of our conversations on this topic, because we know it's an important topic, and you know, a lot of community members of PAC and beyond PAC have been very dedicated to keeping our communities healthy and safe and clean, and so this is our way of doing that. So I'm going to jump right into the conversation because we do have a lot to cover today. Hopefully we'll continue conversations later on. For anyone joining us either on Facebook or on YouTube, we're going to have some time, a good amount of time for Q&A. So if anyone has any questions or comments throughout the webinar or just about this topic, please put them in the chat at any time, and I'll get to them towards the middle and towards the end. But again, I'm going to jump right into it. So today, of course, our focus is, and our topic is, to talk about how to prevent drug abuse and drug addiction, or just substance abuse in general within our communities. And I want to focus on the prevention part of it, because that is a big part of today. But beyond just preventing, we really want to take some time to understand what and how leads community members to get addicted in the first place. And so that is why it's our great pleasure, great honor. We're very thankful for Dr. Balzani, who is here today with us, to talk us through this and have this conversation with us. He is an experienced substance abuse and prevention lecturer, pharmacist, and medical director. Has had so much experience in this field and in this topic, so we're very grateful that you've joined us today. I'm going to hand you the mic for the first about 15 to 20 minutes to share your thoughts with us, and then we'll get into Q&A.
Thank you very much for having me speak to everyone here. I have about 4 hours of lecture to give you in about 20 minutes. So hopefully everyone's awake and paying attention, because it's a very detailed topic. And as Abir said, I've been working at this for about 50 years. And there's a lot of new theories and a lot of new founded ideas of actually what causes addiction. In the old days, we thought people just had a weaker character and, you know, would become addicted, but has nothing to do with that. Okay. Let me just quickly tell you about our brain. Okay. Because that's where addiction enters and works. It's all in our brain. Okay. Unfortunately, we have a prehistoric brain, meaning all our tendencies and all our brain actions are built for the Stone Age, okay? So that when we get anxious, you know, in those days, when there was a noise, there was usually a tiger or a lion. So it stimulated this stress response, okay? There wasn't telephones, communication, so people weren't interacting as much. So everything was life or death, okay? That's the prehistoric times. Nowadays, we have the same brain, which has the same response to when somebody snubs you, when somebody cuts you off on the road, or somebody says something not nice about you. So we have all those things happening today, which didn't happen back then. So, and the other thing is, our brain is a habit-seeking survival machine. Okay, remember that. It seeks habits so that our brain doesn't have to work so hard. So it's going to seek a habit that gives us pain relief, etc. also, because we want to survive. That's all our brain cares about, is to survive. And on top of that, we have a negative bias, meaning our brain seeks out the negative things over the positive things, because our brain uses these negative things because that can be dangerous to our life. So it focuses on the negative things, and we kind of have to train ourselves to think about positive things. And the last thing is that our brain is kind of subconscious most of the time. So basically, it's almost all the time subconscious. 95% of our life is run subconsciously. Have you ever gotten up on Saturday morning and were going to the store or going to to go shopping and you wound up driving to work and you don't really remember how, or when you drove to work, it's like, okay, how did I get here? Was there an accident? I don't know. So most of the things you do are subconscious. And so that's part of the reason why addiction is such a problem. Because no matter what kind of addiction, if it's food, drugs, sex, exercise, alcohol, gambling, they all work in the same parts of the brain, okay? And addiction works on this relief, or this pain, relief, reward, reinforcement. In other words, if you have, and we'll talk about what it does, is that when you have some stress or problems, you seek a relief. And if that relief makes you feel better, then it's like a reward for you. And so when you look at that reward, that reinforces the continued use of whatever you use to get that relief. So basically, addiction is an adaptive response. It's how our brain keeps us surviving. It adapts, and it's a response to the emotional stress. In the prehistoric times, it was tigers and lions. Now almost everything is emotional or psychological stress caused by our environment, our culture, our lifestyle, our lack of connections. And connections is very important, because the opposite of addiction is connections. The inability to comfortably live in our skin, that's another stress. I mean, that can occur with gender identification, with different types of religions and colors, etc. And our brain responds to the emotional stress caused by abuse, pain. It can be physical or psychological, and nowadays psychological is the most important one, and deprivation and or neglect. So this response is to cope with toxic stress, which occurs over a long period of time, by soothing or treating the psychological toxic stress that's chronic with the use of drugs, or a pint of ice cream, or a donut, or a bag of Milano cookies, whatever. Now, the problem is when these stressors, whatever they can be, occur early in life, they're called ACEs, adverse childhood experiences, and they're poorly handled by children, okay? And they fester and they grow over time, and they become toxic stress, which seems to be unbearable, and people seek damaging treatments, especially children, okay? So again, it's this pain, relief. You get a reward from this relief because the pain feels better, and it reinforces what you're doing, okay, and continues it. And unfortunately, that is what reinforces addiction. Now, the psychological aspect of addiction is much harder to remove than the physical. I detoxed and rehabbed about 50,000 patients and removed the chemical drugs from their body after 5 or 10 days, depending. But the psychological addiction, the effects of the addiction that occurred in their brain take much longer and are much harder to cure or to prevent. Now, as I said, if learned long enough and early enough in life, they can be a lifelong crutch, because a child is unable to correctly cope, especially if there's no emotional or adequate emotional adult support. They develop dangerous, again, subconscious coping mechanisms, okay? A child can't fight. A child can't leave a situation if it's occurring at home. So it has to develop certain kind of mechanisms that repress or suppress the discomfort that's occurring if it happens at home, at school, or whatever. And it becomes very difficult. Now, when we talk about pain, there's two different types. The first pain may be this emotional stress It can be a physical pain. It could be an abuse, a rape, a molestation, a bullying, and we'll talk about that. Uh, uh, but that's not the original pain or trauma. The traumatic brain changes caused by this initial stress or trauma, as it tries to deal with this pain, is what the trauma that the child experiences. So technically, addiction is a brain disease, but it's because of the stress and trauma that the child or the adult is trying to repair over time. Okay, that changes the way the brain thinks and how the brain reacts. Okay, and this child experiencing a trauma, which is a pain, changes their brain. And, this is the brain disease of addiction. Now, when I was mentioning ACEs is over the past 20 years is new theories, and we're finding out this is one of the most important potential reasons why people become addicts, why people have physical and mental problems later on in life. They did a study in 1980, and they had 5 personal and 5 familial problems that led to adverse childhood experiences: physical, verbal, or sexual abuse, physical or emotional neglect, and emotional neglect now is one of the most common, and 5 familial problems: alcohol or drug use in the family, domestic violence, especially towards the mom, a member of the family being in jail or having a mental illness, and divorce, death, or abandonment of a parent. Those are all big stressors in a child's life. And if there's no adults who are emotionally available to talk to this child, okay, the child is going to make up its own kind of relief, okay, because of this constant stress, okay. And as I said, nowadays there's so much widespread and unrecognized emotional trauma because of today's world, what's happening. And some of these can be either cultural, racial, include bullying. Children in foster care is a major ACE, people in the juvenile system. Even a hospitalization or an operation or an accident or an injury can cause major problems for young children if someone is not there to help them cope. Violence is another big thing. Violence in the home, in the community, in the world, or even on TV. Too much violence can affect a child and make it try to cope with some other kind of things, such as drugs or food. Now, trauma does lead to some conscious, at most everything is subconscious, but trauma leads to subconscious and understandable decisions to seek relief from this ongoing effect of trauma. And so people seek quick, short-term relief, which may be addiction, which may be food. And that leads to some neurodevelopmental and psychological and emotional damage. And it can impair social and learning abilities. As I said before, isolation is a big problem because the opposite of addiction is connection. Okay. Now, a lot of studies, as we talked about in these past years, are showing that ACEs, adverse childhood experiences, are that have not healed over time because they are overwhelmingly concealed from awareness. And why do people not mention it? Because of fear, because of shame, secrecy, or social taboo. If a family member is doing something to a child, they may fear bringing this topic up. If a child feels like they are gay, social taboos are changing, but they still may feel uncomfortable with telling people. And this leads to an internal stress in the person. So it's difficult to get answers of how much ACEs are around because I said people are afraid. Now, a lot of studies are showing that these unrecognized ACEs are one of the major or the major determinant of who becomes an addict. But it also depends on other things, on our genetic makeup, our individual biological factors, age when the addiction begins, the psychological factors of the individual, environmental factors such as drug availability, family and peer dynamics, financial resources, cultural norms, exposure to stress, and access to social support. Social support is very important. That's where communities come in. Okay? Now, I wrote a lecture kind of tongue in cheek on how to raise an addict. Okay? But I'm going to speak about it in a different way, how to not raise an addict. First of all, do not grant every wish and demand that the child makes of you to keep them happy. And for all intents and purposes, do not be their friend. You are their parent, you are their teacher, you are the educator, you are the disciplinarian. You're not a child the same age as your child, so you don't want to be their friend. And if you give them every wish and every demand, this is going to foster instant gratification. And that's going to just increase. And over life, that's not going to be happening. The other thing that can prevent addiction also is food. Feeding a child a high sugar carbohydrate diet is probably one of the worst things that the food industry is proposing to people. All these high carbohydrate, quick energy, which some children need some of it, but not in these fast, easily digested foods. Having cereals or Pop-Tarts in the morning and pizza for lunch and pasta for dinner. All these carbohydrates release dopamine, and it causes the same response as using cocaine. Okay, a little bit less than the effect as cocaine, but the same thing. So you're teaching a child how to experience this kind of high. Okay, and you have to teach failure and losing is part of life. Okay, if you don't do that, you give a child a false sense of self-esteem. They may feel entitled and that they always win, and so they don't develop resilience. Resilience is getting up more times than you're knocked down. If you're never knocked down, then you feel entitled. That's why I don't believe in early years of Little League where everybody wins, everybody gets a trophy, everybody did a good job. And then when they get to the higher leagues in baseball or whatever sport, you missed the ball, you didn't hit the ball, they get yelled at. Why are they getting yelled at? A few years ago, everybody was good. It's very confusing for a child. And basically, we all are in a continuous state of partial attention. Everybody out there, including me, is thinking about 10 to 12 other things in their mind. So we're not 100% paying attention to what's going on. Especially if your child is speaking to you at night and you're on the computer and you're looking at television, can you really understand the child? Are you really giving them complete attention and understanding what they're saying? That's very difficult. The digital world is very stressful between video games, constant interruptions. You need full attention to give emotional support. The other things that can affect addiction are poor sleep. If you let a child have the bedroom with a TV, a computer, a cell phone, and an iPad, that's going to be running all night, they're going to have poor sleep. That affects our brain, that affects our development. And on top of that, when they wake up, you feed them a high carbohydrate diet, it's going to be difficult. In today's world, there's also a lack of interpersonal skills, okay, because of the computers. People just text people use emojis, so they don't see how a person reacts. Now, for parents, if you're a negative role model, if you're sitting on the couch at night watching TV, using your computer, smoking, having a drink, your child is going to emulate you. Okay. They think you're a god. So, you have to be careful. It's dangerous. And one other thing is when kids go off to college, parent thinks, okay, they're grown up. They're not. They're children going to college. The brain doesn't mature until about the age of 20 something, usually 25 to 28. And you have to allow a child to make their own choices, good or bad, and allow them to suffer the consequences. Okay? You can't fix everything for them because then children don't learn. And obviously, you need some exercise or activities. So the things that we really have to develop in a child is resilience, delayed gratification, positive thinking, self-esteem, not narcissism, and growth mindset. Prevention is really creating and sustaining safe, stable, nurturing relationships and environments. You have to have a relationship with your child. You're not just their boss. You have to be closer than that. Okay. You have to have a relationship with your child to have a two-way connection, for them to talk to you and tell you things, and for them to listen to what you're saying. So recently I attended a seminar called Connections Matter. And it's basically about community connections, because the connections define the strength of the community. Thank you. I'll answer questions now. I spoke pretty quick, but I hope some of the things you can understand. But basically, it is a very detailed topic. It's changing all the time, and it's related to a lot more than just the drugs. Notice I didn't talk about any drugs at all, because to me, the drugs are not important. It's what's going on in the person's mind, and so drugs to me don't make a difference. In my early years in treating, I talked about drugs, what they do, and basically, a pint of ice cream is just as bad as heroin. If every time you have a problem, you go for that pint of ice cream. We see that all the time on television when girls break up with somebody. They sit in their sofa with a pint or a quart of ice cream, and so yeah. I'll stop talking now and answer questions.
Thank you for that. I just want to, there's a lot of comments just thanking you. I saw a lot of reactions to a lot of what you said. So I just want to take a moment. Thank you for sharing that. I think it's really important. It's one of the first times that I've heard this conversation being centered about childhood and the way that we are raised as children. And you think it was more, it's simple when you just hear it, it's very simple. And so I think that's a very important analogy. And even talking about, this, we've normalized and kind of laugh at, like, oh, they have a sugar high, right? But not really realizing how that can actually affect them in the long term, or start, normalizing patterns that maybe aren't okay. So I had some questions prepared, but there are a lot of questions from the audience, and I'm going to read them out loud and try to show them on the screen also at the same time if I can. Our first question is, hi, Dr. Henry, I hope you are doing well. The major problem in our community is heroin addiction. And so how can we help people that are already on that high level of addiction with with a drug like heroin?
Well, basically, first of all, you have to be able to speak with the person, basically not yell, scream, blame, say negative things, and basically be able to get this person into the hospital or a detox or rehab. There's many in the area, and try to remove the drug from the person. That's the initial step. Okay. And then there has to be some follow-up. And what I'm seeing now is there's a lot of people who were previously addicted and come into the hospital, and now will speak to this person who's maybe still high on drugs to get him to go into a detox, and then who follows up with this person. Because, if you start telling a person you got to get off this stuff, and that you've never experienced an addiction, these addicts will not listen to you. But if a person who previously was addicted speaks to them, and that we're seeing gets the most response. When a person goes to the emergency room, someone will come in and say, look, okay, I've been an addict for 10 years and now I'm clean, and I think we can help you. If you have to go into detox, I'll talk to you. We'll find a way to get you in detox, and then I will follow up with you. And if they don't go right away, some of these peer people call them up in a day, say, okay, what do you think? You want to go in? So that's the initial step. And then it's really counseling. And, it takes a long time. And unfortunately, nothing has changed. The recidivism, or the amount of people that go back using drugs, is still about 80%. Okay, and we're trying to lower that, but it's very hard in today's society.
Yeah, unfortunately, that's kind of the follow-up question, and we talked about this a little bit earlier before we went live. But just talking to community members, I think one of the biggest problems right now is, families will give their child, or the community will give that community member the support. They'll go through rehab, they come out, and then they relapse. And so we had some questions about, what are the best ways to ensure that people don't relapse? What does that, you did mention having someone who's a peer who's already went through it. So just any thoughts about maybe how we can ensure that that there is no relapse, right? And that they stay as clean as they got.
I wish there were something that would ensure that people don't relapse. In over 50 years, I haven't found it. But the best way is to be sympathetic and empathetic with the person. There's no yelling, there's no screaming, there's no blaming. Maybe it is to find, basically, okay, when you use this drug or you do this, what do you feel is being relieved? Is it something that happened long ago? Or what stimulated this? When someone yelled at you or something, does that remind you of the coach that screamed at you, or when you were in baseball, or the teacher that brought you up in the middle of the class and made a fool of you, and that's what you feel bad about all your life? So when you feel dissed or dismissed by somebody, you feel that way, and then it makes you want to use. So again, finding out the root causes. During my medical career, I became a functional medicine doctor, and in functional medicine, we look for the root cause. If someone comes in with a pain, we don't just give them a pain medicine. Why do you have the pain? Did you drink too much? Did you not sleep enough? What did you do that caused the pain, etc.? So that's what people have to do. They may be doing that in the detox, but it's really the counseling afterwards to find out the root cause of the problem. Because if you give a bunch of people narcotics, only 10% will become addicted. And those 10% most definitely will have had some kind of adverse childhood experience or teenage experience that affected them, that caused them for this. And when you find that and you get the root cause of the problem, then you stand a chance to keep this child on the straight and narrow.
Yeah. And there's some comments about parents and children having conversations. So I want to kind of just continue the conversation on this before we get into the community-centered focus, which is the other set of our questions that I'm seeing. So a couple of questions. And actually, before we get into that too, there's a question asking if you believe marijuana is a gateway to drugs, and can you share some of your thoughts about the legalization of it and the selling of it before we get into the child parent conversation?
Anything that has marijuana has an addictive potential, absolutely. Anything that stimulates your hormones or changes your brain neurotransmitters is addicting. Smoking is a gateway drug. Smoking anything, smoking tobacco, because smoking is addicting. So you keep on smoking because you're stimulating your addiction. Marijuana is even worse because it alters your senses. You think marijuana is something that's produced by this wonderful company that makes sure that it's clean and 100%. That's not true, okay? Marijuana is produced by little places here and there even medical marijuana in California and Alaska, which had medical marijuana for 20 years, they've seen multiple uh, fungus, bacteria, um, toxic chemicals that are used to distill the marijuana in these things, and they're giving that to people who may have immune problems with medical marijuana. So it's not going to get better when in a month or two, when there's marijuana that's legalized all over the place in New Jersey. And even right now, before I mean, it's legal, but you can't get it. But right now, you can get something called Delta 8, okay, in every smoke shop you can get right now. And it produces about a 5-hour high. Okay. You have altered senses. I'm a pharmacist. I was, and we tend to try everything in this field. I like to tell things that I know that really happen. So I experienced it, in my reclining chair with my wife taking notes. And I was high for about a half hour. Okay. Initially really high. And then over 5 hours, I had altered senses of walking and thinking. So, that's just Delta 8. And you have Delta 9, which can be, in my younger days, marijuana was purely garbage. It was twigs and leaves, and it was 4% Delta 9 THC. Now it's 28 to 35% Delta 9 THC. So it's 7, 8 times stronger. And if you use something called dabs or shatter or wax, that's 95% Delta 9 THC. A pinhead of dabs or shatter can put somebody into hallucinations. So it is really a dangerous drug. There were going to be more accidents that occur, and it's not, it's not a pure drug per se. There's a lot of chemicals used to manufacture the marijuana, including fungicides and pesticides and different things. So it's very, very dangerous.
Yeah.
If you talk to any kids, they'll say, "Oh, but it's legal." Well, that doesn't mean anything because they think it's good and safe and wonderful. But kids are now smoking and vaping in school. So
Yeah. So that's actually the next question that we had from the audience is, what is the best way for parents to talk about to talk to their children about drugs in a way of educating them, like before, let's say, to actually prevent, right? What's the best way for parents to talk to children to educate them about the harms of drugs, especially because something like marijuana is getting a lot more normalized in society?
well, the first thing is to make sure the things that you're telling a child that they have self-esteem, okay, and self-worth, and that you have emotionally understanding with them, that they can talk to you about anything. Okay, you have to be close. A child and a parent needs to have a relationship. You're not just their parent because you can't, it's not like I'm your parent and I tell you what to do, that's it. You have to have a relationship with them and understand and be emotionally available when they come and say, I have this problem, and I don't know what to do about it. And that came up this past weekend. I was at a football game uh, where my daughter is in the band, and my grandson was running around with all the kids. And then he came up to me. Now he's 11. He said, "Grandpa, I have a question." I said, "Sure, Tommy, ask me." He said, then he got real nervous and he said, "Oh, no, 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 never mind, never mind." And I spoke to him, and "Tommy, you can talk to me about anything. It's okay." And eventually, in a few minutes, he got over and said, "Grandpa, I was playing with the kids and somebody was offering marijuana to one of the girls and stuff." I said, "Well, what did you do, Tommy?" He said, "Well, I got out of there really quick." I said, "Tommy, that's a great job. You did really well. I'm very proud of you. You understand the problems that can occur with marijuana. It is dangerous." He's 11, so I can't go into it too much, but I do speak to them, and my grandchildren have listened to some of my lectures, so they understand it. So explaining about drugs is very difficult, okay, for a lay person. There are many different kind of drugs, and And they all have an addiction potential, but you just have to, you can't, fear doesn't last very long. You can't tell a child, it's bad for you, don't do it. You know, and they'll say, well, other kids do it and I see they're fine, but are they really fine?
Mhm.
Are those kids having problems? And if you've raised your child the correct way, if you have a close relationship with them and you tell them, look, anything that you don't like or you don't want, talk to me about it and we'll deal with it in such a way. But drugs are very dangerous. Okay. And, they can harm you, they can kill you, and it only takes one time. It's not that you have to be continuously using it.
Yeah.
And those two things, being close and personal and just telling them their problems, there are problems with the drugs, and that they can speak to you anytime about anything without being reprimanded that they're speaking to you or whatever. That's
Yeah.
important.
Yeah, no, and that's a great. Thank you for sharing that example, a personal example with your family. I think that's the best way to build that confident relationship within the family unit, so that they can come up to you and ask you these questions. And I kind of want to shift now, because we focus on the parent-child relationship, to the communal, role that we can play. And so one of the questions, and a personal question for us, because we are a community center, what kind of role would you advise community centers like ours to take in fortifying good habits in childhood or from early on, or just in the community in general, so that children can turn into successful adults?
Well, I think as a community, and as I said, I attended this lecture, which was, 4 hours about, community uh, connections, and how communities have the ability, maybe in their meetings or their seminars or their, like you're doing here. You're in the forefront. You're doing these lectures for people in the community, but having things that bring close relationships among people and close connections, having barbecues, it may seem silly and stupid, but if you have close relationships with people, people may be more liable to talk with other people, ask more questions, allow the questionings, and in any type of community, that's a problem. And then in some communities you have to face the cultural problems that are there, or the racism, or the religious, or the gender changes that occur. And maybe having meetings to discuss this, and and having parents understand maybe they have to speak to their child, at a young age, or bring them to some of these meetings, or parents just have group meetings where, they talk about their children and discuss, okay, well, we have a cultural difference and people may look at us differently, or, et cetera. And uh, that is enough to cause an ace in a child and cause problems in the future, and have them realize that some people are just stupid and they don't know how to react to things, and they're not, the world isn't fair, and the world isn't uh, is good, but it's there are some bad people out there, and you have to understand that there are just some of them and not everybody. And you still have to treat people with respect and understanding and empathy. Okay, that's a big thing in the world, having empathy for other people. You may not fully understand what other people are feeling, but you can try. But in a community, there can be a sense of empathy among the people in your community, because they're all feeling the same things. Maybe you have mothers groups, maybe you have fathers groups, maybe you have teen groups which talk about, well, what do you feel about this? I feel like we're being persecuted, I feel that this is happening. How does that make you feel? What do you do about it? If people start talking about, what do you do about these things? Somebody says something. Well, I go sing. I go exercise, I weightlift, I dance, I read, give other kids or adults, ideas of what other people are really doing. When I get stressed and stuff, I like to go to the gym and exercise, and I like to drive my car. Those are things that help relax me. I'm also Italian, so I love to eat food. So that's my addiction, which I have to fight with all my life. But if you hear what other people are doing, again, you're not alone. There's not the loneliness, and loneliness fosters addiction. Connections are the opposite. If you can get kids to be connected with other kids who are trying, and you have a group of kids trying, because unfortunately, the problem today is when I grew up, I was oriented to the world by my parents, okay? Whatever they said, I did, period. That was it. No talking back, nothing. Nowadays, the orienting to the world is mostly by peers, because that child goes to school, comes home, gets on the computer, talks with our friends, speaks to them all night, listens to what they're saying. And, as far as younger kids think, parents are stupid. They don't know anything. Okay, but their peers know everything. And this is essentially the blind leading the blind. So, I mean, there's a book and an author named Gabor Mate, and he's an excellent speaker about addiction. And it says, keep your child safe, keep your child close. And he goes through all these things that I was talking about, have close relationships, understand what they're talking about. And because the child, you're an adult, you're stupid, and they're going to not believe you. And believe me, if you keep up having restrictions and consequences for things that they do, as I tell people, and my daughter said this to me one time, I tell people, if your child is not saying, I hate you, you're not doing a good job. Okay? Because that's the child. They're growing up, they're spreading their wings. They're going to say that because they're in a reactive phase of their life. They react to things. They don't think, they just react. They're not responding. As adults, we have to, we get all our senses coming into the reactive part of our brain, but we take some 10 seconds or 2 seconds to think about it, and then we respond. If somebody hits a child, the child just may punch them back. But as an adult, you're supposed to respond by, okay, let's talk about it. Why did you hit me, etc. So there's a lot of things that go into the community can do, but I think you're doing the right things by starting with this, maybe having individual groups of young kids with parents or moms or dads. What do you do? This is what I do. How should we do? And get speakers to come in and talk to them, counselors to say, okay, these are things. So
yeah, I think that's really important. I'm not a parent yet, but that's good to know for if and when I do that. If they're not saying that, you're not doing it right. And you kind of already touched on this, but one of the questions was asking about what communities, just in general, community centers, like, do you think it's important to create spaces where people can process our experiences instead of growing up without processing them? I think you've already answered that, and you are encouraging us to create these almost like focus groups or just, support circles, basically, for either the parents or just the children or both. But like adding on to that, there's another question about therapy. And so how important do you think therapy is, and how much of how much does the lack of getting the proper help lead to more problematic behavior when kids become adults?
Therapy is probably the most important thing. As I said, my years of detoxing people, I didn't do much of a job. I just got them off the drugs. But to me, the therapy and the discussions and the group therapy and group speeches and talks, having a bunch of people who have some sort of addiction or some sort of alcoholism, drugs, narcotics, barbiturates, whatever, even having these people sitting in the group, people who have been detoxed and come back home, have a meeting of these people, Somebody is the mediator, and okay, well, tell us about your problems. How do you think you're going to overcome this? Well, I just got home yesterday, so I don't know what to do. Where somebody who's been home for a month say, well, I do this. I go play baseball. I'm into boxing. I'm into reading. I'm into music or whatever, and I don't hang around with my friends. So even the people who have had a problem and are detoxed, they can speak together. Now, the people who are very young, they need to vent some of their uh, problems and stresses because maybe away from their parents. Because in some families, a parent may be too strict, maybe too uh, difficult for the child to really speak, or something happened in the family by an uncle, a cousin, or whatever, and they can talk about it with other children, with an adult there, of course, and a moderator. But they can bring up their aces. Okay, people need a place to express this and to talk about it, because just talking about it and mentioning what happened to them to someone else is a big relief on a person's brain, and especially for a child, because they're locked in. They can't do anything. They can't run. They can't fight. And that's the sympathetic nervous system, fight or flight. They can't do either because they may be 6 or 7 or 8 or 10, and they're at home and they can't leave or do anything. And so they build up all this stress. It becomes toxic stress, and then they look for pain relief, which is a normal reaction, unfortunately.
Yeah, I'm a huge advocate for therapy, so I appreciate you saying that. And and earlier you mentioned, especially, I appreciate you calling out a lot of, the isms, the oppression that especially marginalized communities face that could, escalate the road to potential addiction. Like, especially in our community, there's a lot of anti-Arab sentiments, there's a lot of Islamophobia, there's a lot of anti-Palestinian sentiments. So I think sometimes we don't correlate the two, but those are very important to be mindful of, especially for youth growing up, the post 9/11 era of the United States. So I really appreciate you mentioning that.
Those are very important things. They can be very strong aces, and it doesn't take much else besides something like that to trigger problems. Maybe they have a difficulty in school, so the added on the racism, the whatever, and difficulty in school, or their personal neurological problems or their physical problems, a couple of these things together, the more aces you have. And the big problem is that this is happening in adults, because aces that occur in young childhood affect you as an adult. And as I said, they're one of the major causes of heart disease, depression, anxiety, etc. I lecture to medical residents in St. Joseph's Hospital, and I give them a questionnaire, and most of them rate high with anxiety, and I tell them, look, you are in the top echelon. You pick this first of all, so don't complain about the hours you have to work, the stress you're under. People are losing their houses from fire and floods, and you're complaining because you're not sleeping enough. So this happens in every person. It's just overwhelming and really overlooked, and that's why ACEs are called the hidden epidemic.
Yeah. And talking to you was the first time I even heard about or learned about ACEs. So I definitely am interested in learning more about it. And I want to thank you for bringing that up. I'm keeping an eye on the time. And I think there's a question about rehab centers in North Jersey that you would recommend for addiction. And I know you did send me a list of resources, which I shared with people, but perhaps that's a good question to focus on to close. Any resources that you can share with us, including the ones that you sent to me. I will send them out for community members who are interested. I put them in the chat, but even other ones that you think we can circulate for people.
Well, as I said, there's one that I know personally, and it is a good resource. I forget, the middle one that I mentioned to you is skip my mind all of a sudden. The one that John works with.
The Blue Crest Recovery?
Blue Crest Recovery, yes. Okay. Don't get old because your memory goes. But Blue Crest is very good, that you can go there. during the day. They have different inpatient, mostly outpatient, therapy and discussions and treatments. And, they do take some uh, uh, insurances, and they do take some people without insurances. That's one of the bigger things, um, to find where you can go for prolonged therapy or whatever. But maybe some of these places will come and speak to, the people in your community, maybe some of the recovering people, and offer them insights into uh, how to get better and where to go. And and these places usually have a person which will help look and find some place for you and help refer you. But there's also, in New Jersey, some of the things I sent you, in New Jersey and Passaic, they have different availabilities. And also that I also mentioned this thing about connections matter. It is a free 4-hour lecture, discussion, teaching about connections. And it really goes into very deeply how connections help people's mind, connections in communities. So basically, if you connect interpersonally with other people, it helps your brain. And if parents can interconnect, they can help children interconnect, and grow. And that's the way you grow, because we're not lone creatures. We're meant to be around people. So addiction is the total opposite. Addiction is alienation. Okay. And people don't want to talk to other people, etc. But then when you get, the family, the parents, the child, you get the community to be connecting. And that's very important. That's one of the building blocks. And the schools, and the churches in the area, they can speak about this and help to build, a good relationship between people. Again, it's connections, it's relationships. Those are the biggest things that can prevent addiction. It's not throwing away all the drugs, okay? Because there's still donuts and coffee and cigarettes and candy and a whole bag of Milano cookies, which occasionally, when I was working very hard, I would stop in between. When I was delivering babies, I would stop in between deliveries, having to go to the office to see 30 or 40 patients. I would stop in the store, get a bag of Milano cookies in the car, eat the whole bag, and then go to work. And it made me feel better. It was not good, but we all seek relief. That's the bottom line. Addiction is not something that's really alien to us. Okay. It really is. We seek this relief. And as I said, our brain is a habit seeking survival machine. It tries to find habits so that your brain doesn't have to use as much energy. And it's all based on our survival. It doesn't care if you're happy. It doesn't remember happy things. If you can look back at 12 birthdays, they might have been the best gifts you have, but you'll remember mostly the birthday where somebody, Uncle Joe, came drunk, or there was a fire in your house, or something bad happened. But the ones where you got a nice present, oh, what did I get? Okay, your brain is trying to keep you alive. That's all it cares about. And unfortunately, the process of pain, relief, reward, reinforcement, it comes into play.
Yeah. I've been putting a lot of the resources to as banners, but if anyone does want me to send the full list of resources that Dr. shared with us, then please let me know. Please message Pack or call Pack, and we can definitely send them to you. The one final question that we have on just the resources that you shared, and we can close here, is: do you recommend for people to move from where, like, if they were trying to get support or rehab, do you recommend that they move from their community and where that happened, where they got addicted, or to stay in that and get support within that community or that city, I guess, or state?
Well, it's very hard. I mean, there's there's a yin and a yang to that, because yes, if they stay in the community, when you talk about addiction, you say remove people, places, and things. Okay.
Mhm.
So if you got drugs from around the corner, from the candy store down the block, or you see your friend every day as you're going to work or to school or whatever, that's going to be something that can stimulate you to reuse. So in that essence, it's very hard in the inner city, you know. But if the opposite side of the coin is, if you say, okay, we have to get away from this, okay, we get away and you go to a different community, okay, you're still the same person, you're still the same nationality, you're probably still going to have the same resentment. And unfortunately, as you get started, you're going to be isolated, okay? So isolation is also a prerequisite to become addicted. You're isolated, and you meet somebody and they say, hey, you want to get high, and let's be friends. And so you're back in the same problem again, because you want to have a friend, you don't want to be isolated, and so there's two sides of the coin. And
Yeah,
most people don't have the ability to just up and move, their job, their schools, and everything. So that's really hard. And just staying away from people, places, and things is much easier said than done. But
of course.
people may be stuck with that.
Yeah. Of course. Well, I want to just thank you again for spending this hour with us, for having this conversation. I want to echo all of the I want to just make sure if you haven't seen all of the comments that have thanked you for just sharing everything that you did. I think it's a perspective that we haven't heard before in this conversation. It's a really important perspective for this conversation and just life in general. So I want to thank you for that. We have a lot of community members who want to bring you back again for a lot of our conversations or just events at PAC. So I'll definitely be in touch with a lot of that. And if you have any books that you have written or that you would recommend to us, please send them over to me and I'll be sure to share them with the community as well.
Okay.
But again, just on behalf of everyone at our center, I want to thank you.
Oh, you're very welcome. As you can tell, this has been a passion for me for over 55 years. I've never been addicted, but somehow as a pharmacist, I got very interested in this. And I learned the way to speak about it and to help people. And, it's such a hard thing to talk about because it's very difficult to understand. And what I try to do is to make people understand it's not this vast area of, well, we don't know anything about it. I don't know. It must be bad in a sense. But, if you look at drugs, narcotics, they're pain relievers. I mean, I've had many operations and taken many narcotics, and I wouldn't have survived without them. But, they're not all bad. They're not all good, but it's how you use them and what's going on in your head. So this is a brain problem that we develop over time, and we have to keep working on it to protect people. Thank you very much. I enjoyed it.
Thank you for all the work you've done on this as well.
Thank you.
Thank you. Have a good night.
You too, Abir. Have fun. Relax. Go relax now.
Will do. Thank you.